they're diagnosed. So they have the lymphadenopathy, but they also have these other little things that we talk about that they may end up having. But non-Hodgkin lymphoma has the poorer outcome. So yes, it still is, maybe responsive to chemotherapy drugs, maybe responsive to radiation, but talking about cure rate, it has far less than a patient who has Hodgkin's disease. So what we try to do are still the same types of things: support the patient, take them through the chemotherapy piece, making sure you keep them safe from infection, and monitoring, because that's all the same kind of things happen no matter what type of cancer process you have in these patients. And then the last part is that's on this section is multiple myeloma. Now, multiple myeloma is considered a disease of plasma cells, so it's a little bit different. Okay. Same. What ends up happening to a patient is you have a demyelinization or taking over of the bone matrix by abnormal protein cells. Okay. And so what ends up happening is it demyelinizes them, makes them very brittle, but the brittleness is coming from the bone itself is being eaten away. So when you look at their x-ray, because a lot of times what their presenting symptom is that a patient comes in with a pathologic fracture. Something simple produces a fracture in this patient, almost like you think the person has osteoporosis, but then you start looking at their history and they tell you other things. They tell you that everything tastes metallic, or when you do lab work on them, they're already in acute renal failure. That's one of the keys you kind of look at. Bence-Jones is a huge protein molecule that can't be filtered by the kidneys, so it kills them off. And you'll see a patient a lot of times present with, they say, everything tastes horrible, no matter what I try to eat. So they end up, some of them are getting worked up GI-wise. Other people come in because they have the pathologic fracture. So they come in for something that was simple, they end up with and they do an x-ray and they see all this is taken over. Or you'll have a person that comes in with acute renal failure. And of course we try to figure out why they have it. You don't have any other risk factors, why are you doing this? We don't know why it happens. And like I said, it can be very benign and almost like a control type disease process presentation and course, all the way up to somebody who's very acute, very acutely ill and dies very rapidly when you talk about multiple myeloma. There's no cure per se. What we do is there's medications we can use to manage it, chemotherapy, bone marrow that you can actually do. My sister-in-law, well, she's my ex-sister-in-law now, but actually was a multiple myeloma patient, and her presentation was that she was just feeling tired all the time, and she was going to the doctor, and of course everybody calls you when you're a nurse in the family. My mother called me and she said, "I need you to call Verna because something's going wrong." And I'm like, okay. You know what I'm saying? So everything is always bad what my mother tells you anyway, because she worse than me. Y'all think I'm with the trach thing. My mother tells me even crazier stuff. The fan's gonna fall on you, you're gonna end up with a head injury because the ceiling fan's gonna fall on your head. Move your bed. That's the kind of stuff she tells you. So see where I get it from, right? So I call her and she says that she was on her way to the hospital. And I said, "What? Are you feeling sick?" She says, "No, I don't really feel bad." She says, "But the doctor told me my creatinine was 12. And I was like, "What?"
What?
I said, "Are you sure?" No, because that's not like, "Are you sure?" She says, "Yeah, he said 12. I said, "You sure he didn't say 1.2? That was right. She said, "No, he said 12. Like 11, 12? I said, "Okay." I said, "Okay, what hospital are you going to?" So she was on her way to Florida Hospital. I said, "Well, I'll see you. I'm coming out there to see where you are." So I go to the hospital.